Welcome to our video on A1c, a crucial measure in managing diabetes. Today, we'll explore what A1c is and what your target should be. A1c, also known as hemoglobin, is a blood test that provides valuable information about your average blood sugar levels over the past 2 to 3 months. This test is different from the daily blood sugar checks you might do at home. For example, an A1c of 7% means that 7% of your red blood cells have sugar-coated hemoglobin. This percentage correlates with your average blood sugar levels over the past few months. The higher the percentage, the higher your average blood sugar has been. While those give you a snapshot of your blood sugar at a specific moment, limited life expectancy or other complex health conditions that make strict blood sugar control difficult or risky. The American Diabetes Association suggests general A1c targets for adults with diabetes. However, it's crucial to remember that these are just guidelines. These goals may change over time as your health status or life circumstances change. Remember, diabetes management is not one size fits all, and your treatment plan should be tailored to your individual needs and preferences. If your A1c is higher than your target, it might be time to adjust your diabetes care plan. Your healthcare team will also consider your day-to-day blood sugar readings, your risk for hypoglycemia, and your overall quality of life when making treatment decisions. Stay committed to your diabetes management plan, and do not hesitate to reach out to your healthcare team if you have questions or concerns about your A1c or any other aspect of your diabetes care. This could involve changes to your medication, diet, exercise routine, or other aspects of your lifestyle. This target is associated with a lower risk of diabetes-related complications such as problems with your eyes, kidneys, and nerves. If your blood sugar levels have been stable and within your target range, you might only need the test twice a year. While general guidelines suggest an A1c below 7% for most adults with diabetes, your personal target may vary. Work closely with your healthcare provider to establish and periodically review your A1c goals. By understanding and striving to meet your A1c target, you're taking an important step in managing your diabetes and protecting your long-term health. However, if your therapy has changed or you're not meeting your glycemic goals, more frequent tests may be necessary. Achieving and maintaining this target can significantly improve your long-term health outcomes. Your healthcare provider will work with you to determine the best A1c goal for your individual situation. A1c offers a broader view of how well you're managing your diabetes over time. So, how does the A1c test work? Well, it measures the percentage of your red blood cells that have sugar-coated hemoglobin. Hemoglobin is the protein in red blood cells that carries oxygen throughout your body. These can include your age, how long you've had diabetes, other health conditions you may have, and your risk for low blood sugar hypoglycemia. For instance, a lower A1c goal, such as below 6.5%, might be appropriate if you can achieve it safely without significant hypoglycemia or other adverse effects of treatment. When there's glucose in your bloodstream, it attaches to the hemoglobin. The more glucose in your blood, the more hemoglobin gets coated with sugar. This coating process is called glycation. The A1c test result is reported as a percentage. Now, let's address an important question. What should your A1c be? For most adults with diabetes, the general A1c target is below 7%. However, your personal A1c goal might be different based on various factors. On the other hand, a higher A1c goal, such as below 8%, might be more suitable for people who have a history of severe hypoglycemia. It's important to have regular conversations with your healthcare provider about your A1c goals. Your healthcare provider will typically recommend checking your A1c to 2-4 times a year. Understanding your A1c results can help you make informed decisions about your diabetes management. Remember, while A1c is an important measure, it's not the only aspect of diabetes management. In conclusion, A1c is a valuable tool in diabetes management, providing a picture of your average blood sugar levels over time. Remember, every small improvement in your A1c can make a big difference in your health.